those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and as always, encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be continuing our discussion on women's health issues, with a concentration on normal and high-risk pregnancies, as well as GYN issues.
These areas certainly encompass the wide spectrum of women's health, and it is most important that we discuss them in terms of the specific problems and the services available. Joining us this evening are two experts in the field, Dr. Maria Emerson, an attending OBGYN physician, and Linda Leah Sanchez, a physician assistant at Bronx Lebanon. Both of them will provide you, our viewers, with their perspectives on labor and delivery as well as GYN treatment process.
Okay, Dr. Emerson, let me begin the program by asking you to define or describe for our viewers what a normal delivery or pregnancy is and a high-risk one.
So a high-risk pregnancy is one that is being followed with a mom that has medical problems previous to her pregnancy. Those can include diabetes, high blood pressure, blood dyscrasias, blood problems, clotting factors that allow them to clot more readily. And those patients are usually followed in our high-risk clinic by maternal fetal medicine specialists. Those are high-risk specialists. Any patient who develops during their pregnancy develops diabetes or high blood pressure is also followed in that way. The rest of the patients who do not develop any problems are followed by someone like me, who's a generalist OBGYN, and are the normal, let's put that in quotes, normal pregnancy, and are followed by all of us.
Okay, let me now direct my question to Leah. Can you define for our viewers your role as a physician assistant in the GYN area?
Well, I work in the walk-in clinic. It's a clinic that we have, it's open every day, Monday through Friday. And we see issues that range from vaginal discharge, pelvic pain, to problems in pregnancy. And those are primarily the patients I see.
Are you busy?
Yes, it's a very busy clinic. In fact, if you want to get seen in the walk-in clinic, you should come early. The hours are 8:30 to 3:30.
That's good, okay.
Now, just what is the walk-in clinic?
The walk-in clinic is sort of like an urgent care for GYN problems that where you can be seen and avoid the ER so that you don't have to spend countless hours.
And the age range is
we see all ages in the walk-in clinic.
And both you, Dr. Emerson, and you are involved in that walk-in clinic?
Yes.
Okay. Now, moving from the defined roles that Dr. Gums asked you about to your day-to-day routines, perhaps you can share with our viewers a general day in your life as an OBGYN physician at Bronx Lebanon.
Starts at what time?
Well, it depends on the day.
Yeah.
So every day is very different. Mondays, for example, I run a 9 to 5 clinic. Tuesdays, I'm in the OR, and I also take care of any patients that are coming in through the ER, for instance, that have a GYN-related issue. On Wednesdays, I cover the walk-in clinic, and also something called the Beta Clinic, which is where we follow patients who have had ectopic pregnancies in the past. On Thursdays, I do my own clinic as well, and that's from 9 to 5. And Fridays, I do something called colposcopy, which is following patients who have had abnormal pap smears.
So you're not only doing low-risk pregnancies, you're doing different things.
No, when I do colposcopy, for example, it's all usually GYN. I do some OB, but that doesn't necessarily make them a high-risk pregnancy, for example. You can have a normal pregnancy and have an abnormal pap. It really doesn't change your pregnancy course. Or
Now, what is a
medications.
colposcopy for our viewers' knowledge?
Colposcopy is it's a study that's done if your pap smear is abnormal, and there's a lot on the news right now about the human papillomavirus. So, for instance, if your human papillomavirus comes back positive, you've been exposed to a high-risk HPV, which is human papillomavirus, then they may send you to colposcopy to see me. And it's basically, the way I explain it is placing someone under a microscope, because it allows me to see the cervix and the vaginal tissue in a magnified way, allowing me to see possibly where these cells that have been reported as abnormal.
And then it's followed with a biopsy?
Correct.
Yeah.
If we see anything that's abnormal, then biopsying.
Okay. Now, what about a typical day in your work routine?
Well, actually, I do the walk-in clinic every day. So I get there around 8 o'clock, and I start reviewing labs from patients from previous days, and then I start seeing the patients. The triage nurse triages them. I get them in my box in my room, and I start calling them. And
So it's really a very hands-on process.
Yes, and you never know what's going to come in.
That's what I wanted to say. Is it necessary for women to make appointments or take advantages of the services that you offer in the walk-in clinic?
Well, for the walk-in clinic, what's great about it is that you don't need an appointment. So,
and if someone walks in, don't tell me the wait is long. How long is the wait?
Well, it varies. It depends on the day, how many people show up. It can vary. It can be quick, or it can be, up to 2 hours.
Oh, that's not 2 hours. That's not bad. I mean, that's good for a doctor's office. Yeah.
Yes. I mean, when you're
I'm going
looking
to
at
check you. I'm going to check you, Dr. Emerson. Is it really 2 hours?
Yeah.
Okay.
I mean, when you're comparing that wait time to an emergency room wait time, sometimes there's a big difference, and especially when you're not coming in with something very acute.
Yeah. Okay.
Now, Dr. Emerson, how do you and your staff decide which patients are eligible for the walk-in clinic?
So there's usually
the patient decide, right?
A triage nurse. Well, she comes in with her complaint. That's correct. And then the triage nurse will evaluate the patient and the complaint, and determine whether she's somebody that can wait to be seen, or if it's something that's very acute that needs to go down to the ER. So, for instance, we wouldn't keep somebody that has severe nausea and vomiting who could potentially have an appendicitis or something worse. So, someone that
Question for you, and then you can leave it to Dr. Emerson. What is an ectopic pregnancy, and how is it addressed by the Women Health Center team?
Okay, so an ectopic pregnancy is a pregnancy that implants outside the uterus. And what makes it dangerous is because most ectopic pregnancies implant inside the tube. The tube doesn't have enough musculature to hold a growing pregnancy, and it can rupture, and the patient can start bleeding, and it can become an emergency.
So treatment options. Do you save the tube, or how often is that done? Yeah.
Sure. Sorry. It's certainly a possibility if the patient is stable, not presenting with pain. We do ultrasounds, blood work to determine what is available for each patient. And then determine whether she can have medical management. And by medical management, I mean treatment with something called methotrexate. That medication is a medication that some people may have heard of when they speak about chemotherapy, for instance. We use it in very small doses to basically break away the pregnancy tissue. And that's a way of saving the tube, the way that you mentioned. So if we break away that pregnancy tissue, that patient still has that tube left. We also have surgical ways of treating that, and like everything else in medicine, moving towards minimally invasive routes. We do this laparoscopically, provided that the patient is stable again. And we can then move in. You can open up the tube and remove the pregnancy. That's a possibility if there's really a need for saving that tube. Oftentimes, the pregnancy is too far advanced and the tube is too affected, and therefore that tube may need to be
Okay,
lost.
since you're doing so well, I'll give you a hard question. Who gets an ectopic?
I mean, that's a great question. Sometimes people do have risk factors. If you've had sexually transmitted diseases in the past, you can certainly be at risk. The tubes may be scarred, previous surgeries in the past. And, sometimes there's really no risk. You look at these patients and you're like, oh, there's absolutely no risk factor. And you follow them several days out, and sure enough, they have an ectopic. And, it can be incredibly scary. It's a scary diagnosis.
Okay, sure.
Now, what are some of the challenges that each of you face in both treating high risk as well as regular pregnancies and GYN problems as well, for that matter?
In the department.
In the department. I'll start with you.
Well, sometimes, people present with pelvic pain and, and you need to figure out exactly what's going on, and it may not be that clear-cut diagnosis. It may require a little bit of investigating. So sometimes that's a challenge. Also,
What about follow-up?
Follow-up.
right,
Yeah,
there's
sure.
a lot of problems with follow-up. So we'll do some tests and we'll ask the patient to come back in a week, or we try to get their phone numbers so that we don't lose them to follow-up, but that is a problem often.
Right.
I noticed that you all have been getting more and more difficult patients recently.
I agree with that.
Have you lamented with Dr. Mikhail at night?
I agree with that.
Yeah.
I agree with that. Certainly there are, I think the challenges, having been at Bronx Lebanon for a good number of years, since 2000, I can say that I think the level of complexity for each patient has increased dramatically.
Yeah. In the last couple of weeks also.
Yeah, no
Right.
doubt.
Okay.
Okay, well, on that note, Dr. Gomes, we'll pause for a short break, and when we return, we will continue our discussion as well as take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241. And please call us.
In this year of neonatology, we recognize the extraordinary and successful life-saving efforts of our neonatal team. Every day, they are truly making miracles happen for the tiniest of babies.
We have saved thousands of babies throughout the years. There is nothing more satisfying than knowing that because of our care and attention, they can live their lives to the fullest as healthy young adults.
We care for each of our newborns as if they were our very own, including educating parents and assisting them in navigating the new journey with their child.
Seeing is believing, particularly for Norma Rodriguez and Raul Velasquez, the proud parents of triplets Nyla, Nilani, and Nayeli, successfully delivered by Bronx Lebanon's high-risk obstetrics team.
Gently, very good. Okay, very good. Now with 3 out, beautiful, very fine.
Triplets are a rare occurrence. The baby girls were delivered by a C-section in excellent condition. They received follow-up care in the neonatal intensive care unit because of their low birth weight.
And when it comes to follow-up care for these triplets, as well as other neonatal graduates and newborns, Bronx Lebanon's pediatricians are making sure that they receive the necessary support.
During the first year of life, we check a child's growth, their development, and give all the required immunizations. It's a great joy to us that we're able to tell parents that they have a healthy child.
There are times when premature infants have swallowing, hearing, or breathing issues. That's when Bronx Lebanon's ENT specialists are called into action.
Our physicians, audiologists, and speech-language therapists work closely with neonatologists in assessing these medically fragile babies. When necessary, we correct the problem and also instruct parents on using safe feeding practices.
Vision is equally important for newborns.
In premature babies, the retinal blood vessels are at risk of developing abnormally, which can lead to blindness. We are one of the first hospitals in the nation to offer laser treatment to correct this condition.
The bottom line, is that Bronx, Lebanon is always there for its newborn patients and their families, as well as for the community. Its ER is a perfect example.
Our adult and pediatric emergency departments see more than 137,000 patients annually. We respond effectively to problems related to newborns, children, teenagers, and of course our adult and senior citizen population.
Bronx, Lebanon also continues to lead the way in anesthesiology, dentistry, family medicine, neurosurgery, orthopedics, pathology, psychiatry, surgery, radiology, nursing, and long-term care. Its Bronx Care Network, including a soon-to-be-completed 9-story ambulatory care facility, as well as a new life recovery center for individuals that suffer from chemical dependency, is fulfilling Bronx, Lebanon's role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now, before we continue our discussion, I understand we have a caller. Candy, you're on the air.
Yes, thanks for taking my call. My question, please, is it absolutely necessary for a woman to take hormone replacement therapy?
Is it necessary for women to take hormone replacement?
At what time? What time in your life?
After menopause, after, let's say, in your 60s.
You're stealing my question, but that's okay. We'll answer you now.
No, Candy, it is not necessary. It's really a matter of whether you're symptomatic or not.
What do you mean by symptomatic?
And we're going to talk about
it.
Okay. But, if you're hot flushes, mood swings are often things that women who are entering menopause are really afflicted by. And if that is so severe that you're unable to follow with your normal life, then maybe that is something that we need to consider. It's not the only option out there, but certainly, it's an available option that has been proven to be very good. We've had a lot of controversy surrounding it, but it's certainly not something you need to take.
Okay, severe symptoms, yes, but what about mildly severe symptoms? What about hot flashes? That are
again,
not
on a personal
necessarily
level.
disabling, but yeah.
On a personal level, how well are you dealing with them? Every patient is very different. If a patient is not that severely affected, only hot sometimes and opening a window and that's okay, then.
But the treatment is milder than it used to be for the hot flashes now, aren't they? Isn't it?
I'm sorry, Dr.
The treatment, do you give the amount of medication as we used to give in the old days?
No, we use it less. Yeah. I think after the Women's Health Initiative, everybody became a little hesitant. Yeah. There are a lot of supporting studies that have come out afterwards that say it's okay to use them, but I think a lot of us are still,
hesitant.
Cautious.
Yes, more cautious than you used to be. Yes.
Yeah.
Okay.
Now, on a totally different note, a question we frequently ask our panelists is to share their respective career backgrounds with our viewers, as well as what led you to choose a career in the medical field. And Dr. Emerson, I'll start with you.
Okay. Well, I knew I wanted to go into medicine when I was 3 years old. I am a native New Yorker and did all of my schooling here in New York. I graduated from the Albert Einstein College of Medicine, which is where I met Dr. Gumbs, and went on to do my residency at Bronx Lab.
Right.
And stayed on for my attending years.
And Ms. Leah Sanchez, how about you?
Well, I'm also a native New Yorker. I did all my schooling here in New York, and I always knew I wanted to go into medicine. I was a bio major. I worked at Albert Einstein in molecular genetics, and I did my internship there when I was in college. And then I heard about PA school, and I ended up at the Bronx, Lebanon PA program when we had one. And that's where I met Dr. Gumbs.
Now, is it a good field, before Dr. Gumbs goes on with his question, is it a good field for people in our community to try to get into?
Yeah. In fact, Money Magazine voted it the second best career in 2013.
That's good. You should give me a copy.
Yeah, I will.
Okay. There continues to be much discussion regarding the use of Plan B for contraception. What criteria do you use for this? That's your expertise?
Yes. So we see a lot of patients in the walk-in clinic that come in for emergency contraception. So the first thing we do is we ask them about the timing, about why do they need it, what happened, and if they're within 72 hours, we do a pregnancy test, and if their pregnancy test is negative, we give them the Plan B. We also counsel them about STDs, because whatever put them at risk for needing the Plan B may have put them at risk for an STD. So we offer STD checking to these patients.
Okay. You want to add anything?
Well, that's pretty much it. I mean, it's no longer something that they need to come in for in terms of a prescription, since it's over the counter. On the other hand, exactly what Linda said, we're looking at an STD exposure. So
now, in terms of contraception in general, what are your recommendations, and are there any side effects associated with some of the contraceptives that are used?
Well, there are a lot of side effects associated with some of the contraception, but what we mainly see is a lot of IUD placement. Patients come in to the walk-in clinic with questions about their IUD. They may want it checked, they may want it removed. Also, to start taking birth control pills is another reason that patients come. And we give them the side effects, and we give them all their options, and they decide on what they want.
Right. What are some of these side effects?
It depends on the form, but irregular bleeding is a big side effect.
Right.
Weight gain or mood changes with some other forms. It all depends on the patient and what they want.
I see.
Another question for you. Do you treat many patients with sexually transmitted diseases, and how prevalent you would think they are in your practice? Both of you can.
We treat plenty of patients with sexually transmitted disease across the board. Across the board.
Recurrence?
Correct. We see them a lot in our walk-in clinic, actually, and we get sometimes they've been seen in the clinic. That result comes back to us and they get recalled. So we certainly get a chance to see a lot of them. I don't know if you got a chance to see it, but not so long ago, maybe a year ago, we were on the news for 10457, which is our zip code for our hospital, as the zip code with the highest number of dual sexually transmitted diseases. So we certainly do get our share.
Now, another question we often ask our panelists is to share their respective patient success stories with our viewers. And each of you before the show shared many of those with Dr. Gumps and myself. Now, let me start with you, Ms. Leah Sanchez. Some patient successful outcomes, some success stories that you want to share.
Okay. One big thing that I see patients for is bleeding or cramping in pregnancy.
Right.
And I ask these patients to come back a week later if I don't see the pregnancy. And sometimes they come back and they see the heartbeat or they see the baby, and it's very gratifying to see them happy with, something happy to tell great to tell the patient. That's very gratifying for me.
Anything that makes you happy?
There's something that makes me very happy, and that's the continuity of seeing my patients. I mentioned that I've been at Bronx Lab for a really long time, and I had a patient that I met in the emergency room at the age of 16 with an ovarian cyst, and I followed her up in our clinic, and she is now my OB patient. She's married and pregnant, and we're following through this beautiful pregnancy, and that was fantastic.
Okay, now for the question. Tell me some of your recommendations for a healthy diet. What do you tell your patients about vitamins and food in general? What do you eat? You're healthy. You seem healthy to me.
Yeah, we won't go into necessarily what I eat, but certainly the recommendation is that you have several meals a day. It's not just about the 3 standard meals, and I know that that's really hard in this day and age when we have lunchtime and dinner time, but it's really about sort of letting your body know that there is food available. I follow a very natural kind of approach to that, and is that if we were out in nature, we would be eating a little here and walking a little bit and doing a little here, and that's kind of the way that we should approach nutrition, is sort of in that very natural way, broad, not just one thing. It doesn't mean that you need to be a vegetarian. It doesn't mean you just need to sort of broaden the horizon, make sure you're getting a little bit of greens, make sure you're getting a little bit, kind of like your mother's plate, you know? It's just carbohydrates, protein, and veggies.
What's your success? You haven't gained a pound since the baby or during the baby?
Well, I pretty much tell patients to drink a lot of water, avoid sugars.
Why water? It's terrible. You have to go to the bathroom. Tell me about the water.
Okay, not excessive water.
Tell me about the water. Because I have read that water in the morning gives you a little boost.
Right, yeah. I mean, if they're going to have coffee, try to limit it to 1 cup of coffee per day. Don't go for the soft drink. Go for some water or seltzer or something that doesn't have such a high sugar content, because it's that sugar that makes you gain weight and makes you unhealthy in the long run.
Yeah. Okay.
Now, we've also heard that Bronx Lebanon offers water births. Perhaps you can share that.
Water births.
Yeah,
Yes, we do have some tubs available. You know, we usually mostly use them for pain management. We don't usually deliver patients in the tub, but we use them for pain management very successfully. I must say that patients that use the tub use less epidurals, less morphine or any opiate type of...
Right, and going back to the services of the walk-in clinic, can you list them for our viewers very briefly so when they do walk in, they know what's available to them?
Well, basically anything that causes pain, discomfort, itching. If you want to get checked for an STD, you can come. If you're pregnant and you're early in the pregnancy and you have spotting or UTI symptoms or any kind of concerns along that's basically most of the patients that we see.
Okay. Did you want to add anything, Dr. Emerson, to that?
I mean, that's pretty basic. If there's a discomfort that sometimes shows up 2 days after you've seen your doctor,
right?
You know, it's a great time to be able to say, okay, if I have time, I can go over to the walk-in clinic and address that.
In a minute and a half, can you perhaps you can give us recipes for a successful care in your area?
In the women's health area.
In the women's health area.
You know, I think it's about keeping on top of everything. So screening, incredibly important. You know, those we've now turned into doing pap smears every 3 to 5 years. But it's not about you being there every 3 to 5 years, but being there, you know, annually and addressing those issues that are not piling up for later on.
And you probably, we mentioned it last week, but when should a young girl first see you? At what age should a girl see the OBGYN?
When she becomes sexually active or she's contemplating sexual activity, because that way we can address, you know, birth control, obviously. Yeah. Pap smears are not recommended until they're age 21, but we certainly see a lot of younger patients.
Right. Mm-hmm. And on that note, let me thank you, Dr. Emerson and Ms. Leah Sanchez, for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for tuning in this evening.
In the interim, if you, our viewers, have a question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night.
Thank you.
Good night. Thank you for having us.
Okay.